Welcome to Cellulin Science for Everyone. My name is Roger. I'm a scientist living in Montreal, and this is my channel where we talk every day about science that may interest you. Can you get drunk without drinking? Yeah, you can get drunk without drinking any alcohol. But not because there was something in the water. It's because you have an infection and a lot of the carbohydrates that you have eaten have been converted in alcohol. But by whom? By bacteria or fungi that infected your intestines, and they are converting this glucose into ethanol through a process called fermentation. This syndrome is called auto-brewery syndrome. It's really rare, in fact, and it comes associated normally with other diseases or the previous use of antibiotic that it has perturbed your microbiome. If you want to know more about the microbiome, please check our video. And then what happened? So this person comes to the hospital and then they have the typical symptoms of alcohol intoxication. They have psychological symptoms, they are disoriented, they have problems with speech, they have intestinal problems, so they look like drunk. And it's really complicated to do a diagnosis. There are several tests that can be done. One of the tests that is done is they cannot eat anything and they cannot drink for several hours, and then they receive carbohydrates, and after a while they measure the content of alcohol in blood. So if you are completely healthy, you don't have an infection, the content of alcohol should be normal. But if you have auto-brewery syndrome, these carbohydrates that you have ingested can be converted into alcohol. Also, microbiology tests can be done in order to determine what's the cause of the infection. So it's important to say that most of the cases that are documented, the cause is either Saccharomyces cerevisiae or different species of Candida. But it can be also be caused by bacteria. Then this is going to affect the course of treatment. If the infection is caused by a bacteria, the patient will receive an antibiotic. But if the infection is caused by fungi, the patient will receive an antifungal like fluconazole. Moreover, the treatment doesn't finish just with an antibiotic or antifungal treatment. It requires a change of diet. So these patients have to reduce the carbohydrate uptake in order to avoid the fermentation of the glucose into ethanol, and they have to increase their uptake of proteins. Let's go now to the curiosities. There are not many cases documented, and also this is not a thing that physicians normally face on their regular life. So there are two cases that I would like to discuss. One is an extreme case in which this auto-brewery syndrome is not caused by an infection on the intestines, it's caused by an infection by Candida on the teeth. And then another question that can arise is, what are the legal ramifications of this? So we are not supposed to drive under the influence of alcohol. But what happened with these people that they are not aware of their problem, but then they drive and they're involved in a car accident? So while you have literature talking about that, there is a paper discussing the legal ramifications of this syndrome. But also there is a case in the Netherlands in which there was a car accident and the driver, by breath test and their blood test, show a high content of alcohol. But then it was unveiled that this person, without their knowledge, he was suffering auto-brewery syndrome, so he was acquitted. Take-home message. A balanced composition of the microbiome is essential for our health. When this balance is disrupted, organisms that normally are not pathogenic, like Saccharomyces cerevisiae that we can find it on bread or beer, can grow and create huge health problems, like is the case of the auto-brewery syndrome. As you see again and again and again, the small things in your life can have a huge impact in your health.